Hi, guys. This is Dr. Mahajan. Very excited that we got Dr. Anand on our live podcast. This is very exciting. Dr. Nishant Anand is the Chief Medical Officer for the whole Baycare, and he has tons of things he can add to the community's knowledge about COVID-19 and what else exciting going on in Baycare. So, without further ado, we'll get Dr. Anand to get on a live feed. Do put your comments so that way we can ask Dr. Anand, what he has in mind. And that will be fantastic if you can participate and we can get you, more information from him. So let me get him on the live feed. So here we go.
Hello.
Hi, Nishant. How are you today?
I'm doing great. How about yourself?
Can you hear me?
I can. Yep.
Oh, if I get any better, I'll be like you, brand new.
Yeah, no. It's interesting times for sure for all of us, but it's I appreciate you taking the time out and appreciate the opportunity to come speak to you and your group.
Yes. So tell us a little bit more. I know you're new to the Tampa Bay area, about a year and a half, that ballpark, you would say?
Right. Yep, roughly.
Roughly. So tell me about yourself.
Sure. So I'm a ER physician by training. I trained up in San Francisco, up at Stanford. I spent about 9 years of my career up at a system in Phoenix called Banner Health, and eventually did the chief medical officer for their outpatient services, and then was in Houston at Memorial Hermann. And prior to coming to Baycare, I've been here it'll be almost 2 years at the end of the summer. I was at Advent Health, so I've been in Florida for a couple of years now. Experienced at least one hurricane, unfortunately, but love Florida. It's been a great location, and look forward to great times ahead.
Great. So your Advent Health, was it in Tampa Bay or was it other location?
Yeah, so I was based out of Orlando, but I had responsibilities for all of the Advent Health. They have roughly about 6 or 7 markets across the country, and so
I see.
A little bit of everywhere.
So you were traveling quite a bit, I guess.
Yeah, a little bit more than now. So I appreciate the time to be a little bit home now, but I was traveling a little bit more then.
So I was reading your resume and I was stuck that you changed your career path big time from being a ER physician to more in, population health administration. So what made you switch?
Yeah, no, it's always interesting where career paths lead you, right? We all kind of, if we asked our younger selves where we would end up, we'd probably be wrong a lot of the times. But I very similar to yourself and others, I got into medicine to help people. I always wanted to make sure that I could make a difference. And when I was in the ER, it was maybe I could affect about 20 people a day. In a span of a week, that would be about 100. When I got into administration, especially in situations like this, we have the ability to make a difference for potentially hundreds of thousands of people or millions of people.
Sure.
And so it's been a great opportunity. I feel very fortunate all the time to be able to interact with great people. I still miss the ER days, and having 3 kids, it's always you'll say that those skills never go away because there's always something going on.
Yeah, I got 2 kids of my own, so I can relate to that. You need, all kinds of skill, to deal with them, So yes, so
there's usually
the triage skills.
Exactly.
I'm sorry.
Oh, I said with the 3
Go
kids,
ahead.
or with your kids, there's there's a cry followed by a scream followed by someone coming with some sort of injury going on, but they're all good kids.
Right. So let's talk a little bit about what you see with the COVID-19. I know you've been at the helm of the Baycare COVID-19 response, and we were lucky that we had the other markets to look at, like New York, New Jersey, or Seattle market, as they took the brunt before us. So that we had an advantage of learning from that. But now, we are in the hard zone. So tell us your journey from February, since we start seeing the early cases, January, February, and then, we were modeling to be high, and we didn't, thank God, reach the peak at that time. But now I'm not sure we reached the peak, but definitely there is an uptick. So walk us through what your journey has been so far.
Yeah, I think it's been. I think many of us are in the boat of we're tired of hearing about COVID, and we wish we had never heard about COVID. Unfortunately, it's been an interesting journey. It caught my attention back in December, January timeframe when we started seeing the information circulating out of China, and especially like you mentioned, when it started hitting Washington, the first patient was found in Washington. We started setting up our own task force, and so we started having weekly calls. You always hope for the best, plan for the worst. And so we started thinking about how we would respond. Well, by March, things kicked into high gear where the cases started coming into Florida. I'm sure all of us remember that first patient we had in Florida that actually was COVID positive down in Manatee County. And now you look at us and we've got almost 200,000 or 200,000 plus individuals, 230 that are positive. And so we've come a long way. The months have been kind of fascinating and a little bit different. Again, I wish we didn't have to deal with this, but the month of March was a lot about preparation. PPE, personal protective equipment, the face masks, the shields, the gowns, getting that was predominantly consumed quite a bit of our time. The patients were very few, as we all know back then, but making sure that we were adequately stocked with the supplies we needed consumed most of the month of March. In April, we started seeing the cases start to continue to rise. But at that time, we were starting to see people slowly come into the hospital, and a little bit by bit, more and more people were coming in the hospital. What's fascinating is when you look at the two milestones when the number of new cases started going down, one was when the schools closed. About 8 days after that, we saw that the number of people coming in were actually less. And then when the state shut down around April 3rd, we started seeing cases go down. Fast forward to May, what we started seeing are the nursing homes. Almost 90% of the people that were coming in were from a nursing home. And then as we fast forward into June and July, as you know, it's been a younger age group. That 18 to 35 age group has been the ones that have tested positive. And our hospitals now, we've actually increased significantly with the number of COVID patients we have.
So what you think about the schools then? You made an interesting point that when the school were in session, you were seeing more cases. So now, in Florida, the governor wants to open the schools, and the president wants to open the schools, and a lot of parents wants to open the schools too. Kids wants to open it too. Some don't, but most of them want to. So how do you anticipate that affecting? Already we are, reaching a big capacity in the hospitals, in the ICU. How are we going to deal with that?
Yeah, I think, I like to start from the higher level and then kind of work down. I think that we have to redefine our normal lives for the rest of this year and maybe potentially longer. We have to adapt our lives to wear masks when we're within proximity, within 6 feet of another individual. We have to get into a situation where we feel comfortable with that. The data shows us that we can be successful. When we're able to, we got to socially distance. Again, if you're not within 6 feet of an individual and you're not coming into contact, you're going to be more likely to be safe. You won't be spread. And then hand washing and some of the typical things. I think those all have to continue. When it comes to the schools, as a parent, I have to say, I want all kids to get the best social education as well as the intellectual education that they need. And so I think as we start to look at this, there's ways to open safely. I know we have a lot of smart people from the state, the counties working on this. And so as we go forward, I think the thing I want most for all of the kids is that they're able to have a safe environment where they can learn and they can be educated and they can hang out with each other. So I think there's more details to be worked out in the next several weeks.
So, I was reading data recently, and I want to take your thoughts on that. so far, WHO and everyone's saying that it's a droplet infection.
Hmm.
And now the data is coming, it's a aerosol infection as well. And that makes a big difference in my thinking, because as you know, the aerosol is less than, for the, our community, I'll just explain, the aerosol is a smaller particle, less than 5 micrometer, and droplet is bigger particle. So the reason I bring it up, just by inhaling, exhaling, you can have the aerosol in the environment. And the hospitals, the indoor spaces, though the hospitals are still better set up for taking the aerosol out with additional measures you guys have taken. We'll come to that in a minute. But how are you going to open the schools? If the aerosol is one of the important way of communication from one person to another, 6 feet not going to be enough. It's going to be accumulation of droplet hanging out in the air.
Yeah, I think there's the point that you're bringing up. One of the frustrating things for, I think, all of us in the medical community is that since this is a relatively new strain of virus, the coronavirus for us, we're still learning things as we go along. As you alluded to, in the beginning, they thought it was aerosol, which means it hangs out in the air. Then there was guidance that it's mainly droplets that live on surfaces. Now there's some, again, concern that it may have some certain situations where it's aerosol and it could hang out in the air. Specifically today, the World Health Organization, looking at some of their material earlier today, there's procedures in the hospital that are predominantly the ones that are going to spread those. So whenever we do anything that requires putting a tube in the mouth or into the lungs, those types of procedures, we always take extra precaution. We make sure that our staff, our team members, and our physicians are prepared with almost full personal protective equipment. When it comes to schools, I think again, we'll continue to see there's going to need to be some screening on the front end for kids. Anyone who looks sick, they're going to have to be evaluated and potentially sent home. Some school districts are looking at putting masks for the kids. Some are looking at doing virtual offerings. Again, I think there's safe ways to do it. Each school is going to have to look at it based on their own individual circumstances.
Coming back to the hospitals, way back in March, I saw, I belong to Mont Plant, one of the Baycare big hospital here in Pinellas County. And I saw that, you guys were early on, made it COVID, non-COVID floors, and same thing with ICUs, COVID and non-COVID.
Yeah.
But, smaller hospitals have difficult time separating COVID and non-COVID. So walk us through what challenges you had with not having enough negative pressure rooms and, not able to physically separate the COVID and non-COVID. So how did you guys manage the logistics?
Yep. Now, from our perspective, we had to do several things. One is we had to be able to segregate the COVID positive individuals from those who are not. And so we had to create dedicated areas where the people who were COVID positive or possibly had that would go. So in our larger hospitals, like you mentioned, we could have a whole unit devoted to the patients that were COVID positive. We can wall it off or screen it off so that everyone going into that unit would have all the personal protective equipment. That was step one. In our smaller hospitals, we were still able to do it. We had to create divisions for the patients so that they could be in one area of the hospital. We did the same thing in our emergency departments. We created a path for COVID positive individuals and one for non-COVID individuals. So we basically took the hospital and created almost 2 tracks for those individuals. As time progressed, the other thing we decided, the thing that I worry about, and I know our team worries about, is making sure that our team members, physicians, and other patients are safe. And so we went to a universal masking policy within our hospitals, which means that everyone who comes into the hospital needs to wear a mask. And I think that's had a pretty significant effect on making sure that people are protected. Even our patients, we can't, if they can't wear a mask because of a medical condition, we obviously wouldn't put it on. But we do ask the ones that are able to put on a mask, and that's really made a significant difference.
I was reading, Nishant, the article yesterday in Wall Street Journal about University of Illinois, Chicago. The hospital is 500-bed hospital, very good hospital.
Sure.
And out of that staff, about 6 to 7% is positive for COVID, and a few deaths too within the staff. Mm-hmm. How is Baycare? Are you guys tracking your staff? how they're getting in-house infections? What's your strategy there?
Yeah, great question. So again, we focus a lot on the prevention of infections amongst our staff. So we talked a little bit about the universal masking. We do temperature screenings. One of the difficult decisions we had to make was actually to limit visitors. We all know that if we were in the hospital, we'd want visitors, but we knew that that's a portal of entry. People could come in, vendors, other people trying to come into the hospital. So we try to keep it limited to personnel that needed to be there, and that helps significantly. What we also do, in addition to screening, temperature checks, in addition to the mask, what we do is when we identify someone who's positive, we do contact tracing very effectively to identify where they are. We also created what's called the Hotspot Squad. Funny name, Hotspot Squad. We modeled this similar to what happens in forest fires. You have people the fire people put a perimeter around the fire, and then you have these small fires that kind of break out. So what we did is we had a team that goes around the hospital looking for any opportunity to prevent infections. And as we do that, we're seeing that the rate of infection from the hospital is actually pretty low now. Most people are getting infected from the community.
I know the CDC has a voluntary requirements for hospital to report inpatient, if the patient got his nosocomial COVID-19. What's the status in Baycare? Are we having less now with the universal masking, or where do you see it?
Yeah, for the most part, it's extremely rare to get acquired within the hospital because everyone's wearing a mask. More than likely, they had it before they came into the hospital.
Where does Baycare stand today with the surge? I know Phoenix, where you came from, and in fact, I was looking at your history. You came from Banner, and they are, Phoenix is right on the top right now, unfortunately. And you went to Houston, you said?
I did, yeah.
Texas, yeah, and they are on the top. And now I hope you're not taking it to Tampa Bay. But how is Baycare coming up with a strategy if, God forbid, we get to those numbers as Phoenix is getting, as Houston is getting? They are the hotspots. Let's face it, they are the next New York, right. Whether we like it or not. God forbid Tampa Bay gets it. How is Baycare prepared for that? Extra, beds you're going to need, extra personnel you're going to need, extra PPE you're going to need, extra negative pressures rooms you're going to need. Hopefully not as much vent, as we know more that vent right. is not the best strategy.
Yeah. No, great. No, I appreciate that. And yeah, unfortunately, I'm the common link. The places have all been hotspots right now. It also argues against COVID being heat sensitive, right? All those areas are really. So from a Baycare perspective, what actually, I take a lot of pride in. Our team spends a lot of time planning for the future and potential scenarios. We always hope that it doesn't happen. So we have plans in place, just like we do for hurricanes. We have plans in place if the number of people increases, we have units that we can bring online. If we need additional staff, we're hiring additional people. We're also working with staffing companies to bring on some additional staff as well. So we plan for those situations. We've got ventilators that we call disaster ventilators that are there if we need it. We're also planning, again, the next step is if Baycare resources are depleted, we're not there yet, but we also have partnerships with the county and the state to just start the conversation, develop the plans for what we need to do if we got to that situation.
Yeah, I just interviewed a couple of weeks back Tom Rudd. He's a CEO at a big hospital here in Pinellas County at CA Hospital, Largo Med. And, he was saying that you guys have a very good communication among different systems, on the Pinellas County as well as Hillsborough County side, which is, very heartening to hear from a community standpoint, that you guys talk and you guys coordinate, because end of the day, it's a community thing. It's not just one hospital thing. Right. So that was very good to hear that you guys are in constant conversation on day-to-day basis. You have a task force, which talk to county commissioners and, so it's good to see that you guys are working together hand in hand.
Yeah, I think the realization, and this is what gives me comfort, is the realization is that none of us can deal with this emerging crisis by ourselves, but together we're going to be able to really be successful and help the community in this time of need. So like you mentioned, the health systems, we had a call earlier today, so we talk pretty frequently. We have a call with Pinellas coming up a little bit later tonight, and then Hillsborough and the other counties we served also. So we are all working together with the same goal.
What's your projection, based on the data? I know you get a lot of data from all over CDC, from local health departments. What's your projection for Tampa Bay in next 1 month, next 2 months? I know the models can be good or bad depending on how people behave, but you can't control that. But based on models you're getting, where you see COVID in next month, 2 months, 3 months?
Yeah, I think one of the unfortunate things in this situation I've come to just accept is that the only way we're going to know that we've hit a peak is when we're on the backside of the peak. Things are starting to decrease. Using the data points that we have, what I do believe is that we're going to continue to, at least for the next couple of weeks, see cases increasing. The mask, I believe that's going to have some benefits. So there are mask ordinances in a couple areas, but I think from the medical perspective, wearing a mask, we all know is beneficial. And if you go around town nowadays, you see people wearing the mask. I think that's going to have some benefit. I think people are starting, they're already aware of COVID, but I think people are continuing to become more cognizant of what they're doing. And so I'm cautiously optimistic that as we go along, we're going to start to see some flattening of the curve. But I think time is what's going to tell us how dramatic that flattening is going to be, how quickly it's going to happen. There's a lot of factors into play in this situation. So I think we're going to have to watch and wait.
I got an interesting question from Elizabeth Walker. I think she's a nurse. So let me put that up there. So Elizabeth is asking Dr. Anand, there'll be need to pull RN from external sites to fill needs in inpatient side, ? What do you think?
So at this time, like I alluded to, we have plans in place to increase our staffing. What we're doing is we're working with existing nurses that we have. We have new hires, so we've hired additional nurses like we normally do, and we'll bring them on. We are seeing higher volumes of hospital patients than we would normally this time of the summer, especially in the summertime. We see our volumes typically go down, and so we're working with some contracting agencies as well. If there is situations that we need to bring some nurses from outpatient into inpatient, we'll make that decision in the future. But right now, our plan is to. We believe we're in a pretty good place for the next couple of weeks. Never with COVID, you never can say that you're comfortable, but we know that we at least have the plans in place to deal with it for the next couple of weeks, and we'll reevaluate.
Yeah. So, in terms of Baycare growth, let's get away from COVID. I know COVID is getting toxic. So let's get away from COVID. I joined Baycare, I think early 90s, and I was at St. Anthony, and at that time it was run by missionary nonprofit religious groups, and beautiful hospital. And then I started working out of Mom Plan and Mises, and they were separate at the time. Mm-hmm. So I think around that time, Mom Plan and Mises merged. That was the first step I saw in Baycare growth. And then, the whole Tampa Bay community started coalescing, and then the St. Anthony on Pinellas County and St. Joe's on Big Hospital on the other side merged, and then you added new hospitals. So where do you see under your helm and your team, the Baycare going from here where we are right now? There are some rumors that you're looking at mergers.
I think well, first of all, thank you for partnership throughout the last several decades. I think it's you've seen it from the very beginning, even before it was Baycare, and so I think it's been a great story. And what's really nice about Baycare is that we are here for the community. It's been in the community for the entire period. I always answer, there's always rumors out there. I think people are always thinking there's this scenario or that scenario. What I feel comfortable saying is that, we are here to serve the needs of the community. We announced we're building a hospital up in Wesley Chapel, so that'll be coming out over the next couple of years. We're constantly evaluating how we can help to meet the needs of the community. Sometimes it's partnering with our great physicians in the community through our clinically integrated network. Sometimes it's we need to provide home care services and expand some of those services. So we're always evaluating where those opportunities are for the community. But again, we're here to serve the community, and we're proud to be able to meet those needs, and we'll continue to evaluate it. But again, people are always speculating what's going on. But our intent right now is to focus on meeting the needs of the community.
I know in healthcare, things are moving at such a fast pace. With last 6 months has been very difficult for small hospitals, with the elective procedures being important for the bottom line not being there. So that brings me to my next question. I know Baycare is cutting back some of the elective procedures effective tomorrow, right?
Yeah, well, so to put some context on this, so first and foremost, we want to make sure we have enough bed capacity to deal with the emerging crisis that we have. That's fundamental to who we are and what we stand for. And so what we announced recently is that in Pinellas County, we're going to look at selectively reducing non-urgent cases. If it's an emergency, we will take care of you. If it's urgent, we will take care of you. There's certain things that can be put off and they don't need to happen right now. Those are the types of cases that we're talking about. Especially if it's going to occupy a bed and you'll be in the ICU or the hospital overnight, those are the types of cases we're looking at. But we're still going to be operating patients who come in and go out the same day. We still plan to do those types of cases, and our outpatient sites are still going to be doing cases. So I know it's very confusing, but we still are going to be operating in certain types of cases. We just want to make sure we have enough beds to serve the community.
I got you. Let's talk a little bit about, I know your tight schedule, so we'll wrap it up quickly. The physician partners, I know you're the leader there. So tell us, our community, what you guys do and what's the philosophy behind, and how is it evolving?
Yep, great question. So as an overall philosophy for Baycare Physician Partners, that's our physician arm. It's basically a network of both employed and independent physicians. Our goal is to do two things. One is we want to bring like-minded physicians who are committed to quality and taking great care of patients together, and we want to support them with resources to be able to do so, best practices, ideas around there. Second, for our patients, we want to have a network of providers that they can have confidence in, that if they go see Dr. A or Dr. B in the network, they're going to get high quality care. So I'm pretty excited. Our network continues to grow. We have a lot of great physicians in it. We're up to over 2,000 physicians now. And wow. It really, I'm very proud to say that they do take great care of our patients.
Where do you see, with the COVID experience 5 years from now, hospitals in terms of operations, in terms of architecture, more negative pressure, more filters, or just overall strategy? How do you see the hospital chains evolving?
Yeah, I think it's going to be one of those, time will tell, because I think we're still in the middle of it. And so, I think it's early to speculate what it's going to look like long term. What I am comfortable saying is, we've had infections before. H1N1, we all remember back 2009. We had the Ebola potential outbreak. It never emerged into too big of an outbreak, but we had that. So there's always going to be potential infectious agents that could come in and do it. So we will have to reevaluate all of our facilities and construction as we go forward to look at that. The good thing about Baycare is the construction team does a great job to make sure that we meet the highest standards in our construction. So I feel like we're in a pretty good position. I think what I'd like to see more is the nursing homes and some of those areas. We're going to have to reevaluate how they perform and how they're built.
I think that's a good point you bring, Nishant. I think there should be more cohesive strategy with nursing homes, because they have the most vulnerable population. If they get a spike, you get a spike. So I think coordination, because I'm a medical director in one of the buildings here, Clear Choice building for the last 15 years. So I see that everyone working in islands, everyone has their own policy procedures. And with the infectious disease, as you said, not going to go away. We're going to have, God forbid, more pandemics coming. I think there needs to be a coordinated effort in each county or, across, different, corporations, just to have everyone on the same page, because one get affected, everyone get affected.
Yeah, I definitely. I think that's a great point. Coordination across, whether it's a nursing home, whether it's home care, whether it's primary care. I think we all have opportunity to continue to improve that coordination. And that's one thing that we're continuing to work on.
Last question. I know you got to run.
Sure.
Give us, audience, top 3 things you learned from your wisdom. And I know you went through Ebola, and you went through H1N1, and now in middle of COVID-19. What top 3 things you'll tell the community, with that 30,000-mile view you have?
Yeah, great. I appreciate that. A couple of things. One is prevention. Focus a lot on prevention. We sometimes we want to deal with people once they've gotten an infection, but prevention is key. So in this situation, masks, social distancing, and hand hygiene, washing your hands is crucial. 2 is preparation and being able to plan. And so we spend a lot of time in Baycare planning for, again, all the contingencies that could happen. And so we'll continue to do that. And then the third thing, I think, is partnerships. So having partnerships, like we mentioned, the health systems working together, the state, the cities, the counties, all working together. Sometimes it's also nursing homes and other services out there. But that partnership and that spirit of cooperation, it's just key to be successful. If we can do those 3 things, then I think, whatever the crisis will be, we'll be able to make our way through it. We hope that we never have another one. I think we're still in the middle of this one, but I think those are some of the keys that I've learned along the years.
So I'll give you one final kudos. I was talking to Adam Rod about having a daycare for nurses at CA. They have a big building in front of Largo Med, and it's empty, and he was hedging his bet. And you guys have a YWCA, run facility right across the street from our plant, and a rainbow facility for sick kids for the nurses and employees. So you guys are ahead of time in that. And anything else the employees should know that you guys have coming up to give them warm and fuzzy feeling as they are getting more fatigued with COVID?
Yeah, I think I'll leave you with a couple things on that. One is, again, we're going to keep focusing on keeping them safe and keeping them healthy. So a lot of time goes into making sure they have all the right personal protection. 2, the physical and the mental stress. We know that people have been working hard, and we know that they need some time off and some relief. And we know also that there's a potential that this could go on over the next couple of weeks, next couple of months. And so we want to help them. We want to support them wherever we can. And so we've asked our leaders to keep in constant contact with their team members so that they can be there to help them and stuff. But just know that we're very appreciative and thankful. I hear about these stories of all this great efforts by our nurses and our physicians. And it's amazing the amount of work that's going on. People are willing to step in and help out no matter what the circumstance. So it just makes us all very proud.
I think I saw one of the stories you sent, by the way, very good emails. That's how I got introduced to you with your emails. They're very detailed. So I saw a story, and and that gave me idea, in fact, from you guys. That you had nurses you can't employ at the time because, in March, I think you guys were very low with your census, and you had them work to make masks, and that was very fantastic use of the extra resources. So I asked my patients on Facebook to get me masks for my, patients who don't have it, and we got tremendous response. So keep coming up with great ideas.
Yeah, and we've just, again, the community's been fantastic with helping out with whatever we need. And same thing with our team members or our employees. Everyone's just always been willing to chip in. So I very much appreciate that and appreciate your time as well.
Final thoughts. Anything else you want to add, or you're tired me interviewing you?
No, it's always a great opportunity to catch up with people. The folks that are out there, I want you all to know that we're working extremely hard. We're here to deal with the crisis. We'll be here to support you throughout it. And, we're very grateful for all the support that you've given us as well. So we'll make it through this crisis, and we're going to emerge stronger on the other side.
I agree with you. Thank you, Nishant, for your time. And I know you're busy, and appreciate the good work you're doing for Tampa Bay community. Keep up the good work, and God willing, 2 months from now, we can meet for drinks instead of through FaceTime or, live media, social media.
I look forward to it.
Take care.
Appreciate it. Have a great day.
Yeah. Bye-bye. Yeah. Take care. All right, guys, we're back. That was fantastic on Dr. Anand's part to uh, come despite his busy schedule. I enjoyed talking to him. He is a wonderful resource for our Tampa Bay community. I think we're in good hands with him at helm at Baycare, being the chief medical officer. If you have any questions for me, do send love and give me some vows, and we'll keep bringing fantastic guests like Dr. Anand on our Facebook Live. Let's see who we got up here. We got Elizabeth. I have a question here. Let's pull that up. So Elizabeth is saying we have some nurses who can assist on COVID triage line. So thank you, Elizabeth, for the beautiful work the nurses do. Let's see, we got Marie saying thank you for the informative webcast. Keep the going. Yes, thank you, and appreciate you joining and tuning in, Marie. It's very important to get support from the community, and that gives us the enthusiasm. So give us some vows and thumbs up, guys, and love. We're going to be talking about the new breathing technique. As you know, this is Dr. Mahajan from Mahajan Medical Center in Largo. I'm a board certified internist, and I try to bring the thought leaders and bring different ideas for the community during this difficult time. And I also bring a breathing technique for all my community, as I believe strongly that we got the tools right here in our lungs. To the breathing, we can control our sympathetic and parasympathetic system. So there's a new technique I'm going to teach you today. I did that in the teaser yesterday. So the guys who listened to my teaser yesterday, they know what's coming. It's called bee breathing, or in yogic circle, it's called Brahmari Pranayam. Let me put on the music. And all right, the music should be coming. Let me know if you can hear the music, guys. All right. If you can hear the music, give me thumbs up. If you like the music, give me a wow. And we'll get started with the breathing. The bee breathing is one of the great tools in addition to the other breathing techniques I taught you over the last few months to help you with anxiety. It can help you if you practice long term with keeping your blood pressure under control. It also helps you get centered so you can do deeper in the meditation. So this is how you do it. You make sure your spine is erect. Relax your jaw and your base of the tongue and your lips, and then you put your thumb up here like this between your cheek and your cartilage in the back, just in front of the ear, and then your two finger goes on top of your eyes, and then the ring finger goes on the nose and the little finger goes on the lips. And then what you do is you press gently the thumb, so you close the ears, and then breathe in through your nose, inhale through your nose, and while exhaling, make a bee buzzing sound like this. So again, breathe in through your nose, gently press the ears, the cartilage to block the ears with the thumb. Breathe in through your nose, no hard pressure on your eyes, just gentle. Keep your eyes closed, breathe in. And then breathing out on exhalation, make the buzzing sound. Breathe in last time with me. Breathe through your nose. And exhale and make the buzzing sound. See? Now you open your eyes slowly, so the light does not bother you and get back to the real world. And it's not that hard. If you practice it 9 times, you did 3 times, you did 6 more times, 2-3 times a day, you do it for a month, you will see that you have better coping skill and you're less anxious, and it will help you calm down and cope with whatever Mother Nature throws at you or human beings throws at you as well. So as Dr. Anand said, if we all keep the mask on, we can leave some breathing space literally in the hospitals and the ICUs for our emergencies, not just COVID, but non-COVID related too. The hospitals and nurses and the staff and the physicians, you don't want to overwhelm them, and then we are like Mother New York, and we have to, deal with the consequences of that, and that's serious consequences. So if we all pitch in with social distancing and using a mask and washing the hands and not going to indoor places like restaurants, bars for another few months till we hopefully get a treatment or a vaccine, it will help everyone not to deal with the disease, not to deal with the loved one in the hospital, and that's the worst thing. They're all lonely in the hospital. So please work together as a community, and we can overcome. And do keep practicing the breathing techniques. Let's see who else is commenting here. We got our favorite nurse, Maria Capolito. Maria is saying it's great to watch Dr. Anand, our Baycare healthcare leader. Great also to watch my favorite doctor, Dr. Mahajan. That's very kind of you, Maria. You are my favorite nurse. Thank you for your kind support. Let's see. We got Delinda saying, thank you for the informative session. Thank you, Delinda, for constant support you provide to us. Ray Davis, our big supporter for Mahajan Medical Center, is watching us with Caroline. We appreciate Ray being a consistent supporter for our podcast and our efforts. Thank you, Ray. Keep up the good work with your union people and keep them healthy and strong and wealthy as well. And with that, we come to our end of our podcast. We have a very exciting guest on next Thursday, Dr. Nihal Shah. Dr. Nihal Shah is a prominent psychiatrist in Tampa Bay area. He works with the residents and the fellows, and wealth of knowledge, has been in the community. Very well respected psychiatrist, Dr. Nihal Shah, a good friend. And he's going to talk about how to cope with COVID-19, with mental health issues, with psychiatric issues. So that'll be a very exciting interview for our community to learn from. We come to the end of our podcast today. Do tune in at 4:30, and please like us, send us comments. Do let me know if you're breathing, and if you're liking what I do with the breathing. Please put a comment. Which one is your favorite? Whether it's the square breathing I taught you earlier, or Brahmari or deep breathing I taught you today, or Prashtika breathing, or the breath of fire I taught you earlier, and then I taught you victory breath, and then I taught you 4-7-8 breathing. So let me know which one you enjoy the most, or alternate nostril breathing. Do comment so then I get a feedback, and anything you find difficult with the breathing techniques I taught, put that in the comment section today. So I'll try to help you there. But do practice it every day, 5 minutes, 10 minutes, whatever you can spare. I think you will see the benefits long term. Thank you so much for your support, and be nice to yourself. Look in the mirror and smile. We'll be all right. Be nice to your fellow family members and friends, and be nice to the Mother Nature and biosphere. Ciao. We'll see you next Thursday at 4:30. Appreciate your support. Give me your comments and like us and share our video with other family members. Take care.